In 2008, in December, I went back to my village after 10 years. So, on my way to the village, I met one of my uncle, and I asked him how he was, and and he has with him, he had his son as well. But I asked him about his wife, my auntie, and when I asked him that question, how she is, and he was paused, and I could see his face become darker, like sad. And then he asked me a question actually, and said that, you know, don't you know what happened to her? So I told, no, I don't. And then he said, well, she passed away. It was, I think, 3 months ago. I think it's in September. She passed away on the way to hospital, which is 2 days. You have to carry in 2 days because she had a complication in her pregnancy. So although it happens quite often there, but this story really hit me hard. That's one thing. The another thing is, in 1999, I went my village after a couple of years. That time I was lawyer in Kathmandu, practicing law in Kathmandu. When I was there, I went there, and there was and part of the village had drinking water. Um, but this time, you know, that drinking water taps didn't exist at all. They were all broken down and everything. So after listening what happened to that my uncle, and also seeing that the drinking water project was completely not functioning anymore, so I asked my father to call the village meeting to discuss about, why it's happening here, what problem we have, and if there is anything we could work together. Um, then I asked them to list the problem we face the most, with the most important problems, the serious problem, I would say. Then they listed one of the high priority for them is the health issues. So, and that the stories that I heard from my uncle, the incident, that also made me realize, yeah, it's a health issues is the first priority that we have to deal with. Um, but that is just the one issue. But there are plenty of issues that we have to address. That's how the idea of establishing the village foundation and work together. No matter where we are or where we could be, a member of the community, there could be abroad. Like there are plenty of them, about 70 actually, of the community members are working in Gulf countries as migrant workers. Some other community members migrated in different part of the countries in search of better life. So moving out from there, it doesn't mean that you don't have a moral responsibility to look after the community where you come from. That's how I myself, as I was born there, grew up there, and I feel it's a moral responsibility that I have to work with my community to make a difference there, and not only to build up the community as the village, our village as a have a good facility, but also build up as like a role model so that other villager like ours could learn something from us. That's how the project of idea of to have this um, village foundation is started. We have two major challenges to deal with. The one is obviously is the funding. The second is human resource. The first one is, to run our project, we would need quite a bigger fund. We would need that. Our community is committed to do their best. So they have committed to give 25% of total budget as a volunteer work. So everyone is working hard there. That's people who have been physically in the village. There are other people like uh, professionals like architect, engineers. They are giving their time. Architect is designing our project free, and also going and supervising that. Then civil engineers are working on the field as well in their time. That's volunteer work. But we still need the fund to complete the 75% of. Out of that, we'll raise some money from our diaspora members who have committed to donate at least 5% of their earnings, which is quite significant in a way. That's the funding side of the challenge, that we have to raise money or approach to the individual and organization who share our dreams and who wants to help us. Another challenge that we have, especially for community health center, is we don't have the human resources we need to run the community health center. So we do have just 5 members of our community are trained as a community medical assistant. They need more training, to work there. But we are still, they are committed to do that. But we would need medical doctors to run it, and nurse and midwives to train the local staff, and also to give to run the day-to-day operation of our community health center. For that, we would defend, and we were looking to recruit the volunteers, the skilled volunteers who are, happy to learn something, to stay with our community at least per month, and if they can do more, that would be great. But more information I will provide them.